Okay. In order to get your ankle to be able to dorsiflex, it's a triplanar joint, so we need a little bit of tilting at your calcaneus or your heel bone. So what we're going to be working on is, though we've worked on this manually, right? This is us breaking the bread or the stick that we talked about. Now we're going to go into a stretch that's going to not only stretch you into dorsiflexion, but it's also going to stretch this portion, the inside portion, to allow for that tilting motion, and that will improve your ankle's ability to dorsiflex.
Gotcha.
Yeah, when I go down a little bit, I can feel it just stretching it.
Great. So now we're in this slant board position, but at a 45-degree angle to bias this tissue, right? You're getting it a little bit into the Achilles, but more so on that inside to promote that everted position. All right, so perfect. So first things first, we're just going to hang out here for about a minute, okay? Stretching. And then what we're going to do is we're going to go into some contractions. All right, so now we're going to go into phase 2, 30-second contraction, where you're trying to tilt, come out of the stretch by going into inversion of the ankle. So all the pressure is on the, essentially from the midline of your foot and over. Great. Okay, keep pushing, keep pushing, keep pushing. It sure is. Are you okay with it? Great. Okay, next phase is the opposite. Now I want you to push on the inside portion of your foot so that you're trying to lift the outside as hard as you can. And so you're going deeper into the stretch. Again, into the Achilles a little bit, but really into this posterior medial retinaculum to try and get that tilt and that ankle mobility. Keep working, you're doing great. So you're driving this that first and that second toe down into the board. Great, and that's your 30 seconds there. And then you can either hang out in that stretch and own it or come out.